Botox is the most common form of what we call neurotoxin or neuromodulator. There are 4 that are FDA approved here in the United States. With needles, we do inject what's called a paralytic or a neurotoxin into the muscle, which causes those wrinkles to relax. Every clinic kind of has different focus. I would say here at Plaza Aesthetics and Wellness, we offer many treatments, but we also want to be the best at what we're doing. We want to offer state-of-the-art treatments that are safe for our patients, that we're very well trained on. That's the most important thing to us. But of our treatments, I would say laser hair removal, microneedling with radiofrequency, the Morpheus, and then Botox, botulism toxin treatments. Those are probably our top 3 treatments that we offer here. When Botox is done wrong, you can have a whole slew of concerns. It could be that you really can't move your facial muscles. You wanted a much softer treatment and you end up getting kind of a harsh or very false looking treatment. Also, if it's injected inappropriately, you can get a droopy eyelid. You can also get a droopy eyebrow. Hopefully that only lasts a few weeks, but that's something, if it's injected very inappropriately, it's something that could last for several months. Yes, a licensed professional should be the one injecting Botox. I would recommend that it be a nurse practitioner, physician assistant, or physician. A physician-owned and operated medical spa is really the best place to seek these treatments. Dermatologist, plastic surgeon. Just because someone is a doctor or a nurse that is offering these treatments doesn't mean that they're going to perform them well. You want to make sure that the person is well trained, that they've received hundreds of hours of experience. Everyone here at Plaza Aesthetics and Wellness has been trained by myself. I've been injecting Botox for about 8 years, and my nurses at this time, they've all been trained under me for months before they're injecting patients. The most common area that we see for botulism toxin would be what we call the glabella. Some people call it the 11s. Some patients just have a 1, but this would be between the brows here. The other most common area we see is here in the forehead. That's the frontalis muscle. So those would be the 2 most common. And then thirdly would be what we call crow's feet, or here around the eyes. Any sort of botulism toxin treatment, neurotoxin neuromodulator, is also a very effective treatment for what we call hyperhidrosis or excessive sweating in the underarms. What we would do is we would numb a patient for this, just because the underarm is a little bit more sensitive. And then we would take off the numbing cream, cleanse the area, and we usually a full vial of botulism toxin, kind of split it up between one underarm and then the other. This is an expensive treatment just because we do need such a large amount of botulism toxin to really assist the sweat gland so it's not continuing to sweat, to kind of kill it off. So it's a treatment that is more expensive than if you were getting facial Botox or maybe just Botox, around the eyes or around the forehead.